Hi, my name is Dr. Usbelger Feldman, and I believe that the most significant use case for blockchain in healthcare is patients' privacy. Did you know that the next invention that will change the way we live is already here? The technology likely to have the greatest impact on the next few decades has arrived, and it's not social media, big data, or robotics. It's not even artificial intelligence. Its name, the blockchain. Why is blockchain so revolutionary? Because of trust. Trust is the key to our healthcare and financial systems. Trust is the single most important element that allows us to interact and trade. Trade originated with human communication in prehistoric times. Back then, people will only trade with people within their tribe that they knew and trust. As the years went by and the population started growing exponentially, it became harder and harder to personally know and trust everyone. In addition, people went from trading simple objects to exchanging different kinds of assets, including health records. As a result, individuals start calling a middleman, like banks, governments, centralized servers, and the cloud, to protect their interests. But what happens when the trust we put in such third parties is broken? Issues of trust start many years ago, and in healthcare, the 1996 HIPAA law was created not only to combat fraud, theft, and abuse in health insurance and healthcare delivery, but also to keep personally identifiable information protected, secured, and private. However, a global issue of trust at the 2008 financial crisis was the last charm. Trust not only in banks and other financial institutions, but also in governmental third parties and big corporations hit rock bottom. At that precise moment, an anonymous person created a white paper comprising a peer-to-peer electronic cash system using the new cryptocurrency Bitcoin. In 2009, Satoshi Nakamoto applied a digital timestamp technique, which was intended to notarize digital documents to prevent them getting backdated or tampered, to the new Bitcoin concept. Despite of you may be familiar with Bitcoin, you may not be familiar with the technology required to put Bitcoin to work, the blockchain. Blockchain is a system which stores information in a network of personal computers called nodes. There is no central entity like a server, bank, or a government controlling it. The system is what we call distributed, which means that all the computers using the network have the same information. Imagine the blockchain like a big public or private ledger that lists all the transactions executed between two parties, including doctors and patients. Each transaction is time-stamped, immutable and eternal, which means once you add information to the blockchain, you cannot go back and change it or delete it. The people in the network that add and verify the transactions are called miners. Miners get cryptocurrency tokens as an incentive for doing so. When compared to Bitcoin and other cryptocurrencies, the Hyperledger platform does not comprise miners or cryptocurrency tokens or coins. Hyperledger is a private blockchain-based distributed ledger platform started on December 2015 by the Linux Foundation. Hyperledger receives the transaction information, runs it through a secure mathematical algorithm that provides them with a unique output called a cryptographic hash or fingerprint. A hash is a function that converts one value to another, such as a 4 GB 3D X-ray into a 10 KB unique mixed group of letters and numbers. It is important to remember that only the hash is stored in the blockchain and not the transaction information or data. On the other hand, cryptography comprises a non-invertible function, which means that if you see or have the cryptographic hash, you cannot go back and retrieve the data. This ensures privacy. Each hash is added to a ledger, and the ledger is stored in a block. Each block is linked to the previous block, creating a chain, the blockchain. Thanks to these unique properties, the blockchain is very hard to hack. The blockchain does not store just a list of transactions or data. It can securely back up and provide proof of existence for any protected health information PHI, like your valuable patient's data and electronic health records, comprised by medical histories, doctor's notes, X-rays, scanned images, procedures performed, batches, ledgers, and billing. There are a lot of use cases with blockchain for one main reason. The power of blockchain lays in the fact of that it can prove that a unique event occurred at a certain time. That event could be a financial transaction or the creation of a document including health records. This characteristic is very powerful. Blockchain is a disruptive paradigm shift because of its ability to digitalize, decentralize, secure and immortalize the validation of transactions and data creation through trust. Trust doesn't rely anymore in the middleman or institutions, but in a mathematical algorithm which doesn't make mistakes. As a result, many sectors are very interested in it, including healthcare. In healthcare, there are many use cases for blockchain, and one of the main needs we have identified is data privacy and security. Implementing the mandates of HIPAA plays an important role in building and maintaining patient trust and a thriving practice. With 186 million patient records exposed in the last 10 years, the government is wondering if enough is being done to keep data safe. In dentistry, large HIPAA breaches have been reported, such as the 151,000 patients record from an Oregon dental provider in 2015, the 4,300 records from a Massachusetts practice in 2016, the Arkansas Oral Center 128,000 patients ransomware incident in 2017, and the almost 4,000 affected patients in Las Vegas practice last year. In 2008, a server at the University of Florida's College of Dentistry was exploited remotely by an attacker, compromising the personal information of more than 336,000 patients. In 2018, a telemedicine vendor breached the data of 2.4 million patients in Mexico. HIPAA violations are expensive. The penalties for non-compliance are based on the level of negligence and can range from $100,000 to $50,000 per record, with a maximum penalty of $1.5 million per year for violations of an identical provision. HIPAA violations can also carry criminal charge that can result in jail time. While CNBC reported that your social security number and credit card information might fetch $2 and $10 respectively on the black market, your EHR could go for up to to $1,000. Healthcare breaches not only cause patients privacy exposure and doctors' reputation jeopardy, but also $6.2 billion annually. This happens because electronic PHI is encrypted through a key, as specified in the HIPAA security rule. To avoid a breach, the key should be stored at a location separate from the data. Thus, just by accessing the key, encryption is vulnerable to hacking, fraud, and theft. As compared to encryption, due to its cryptographic nature, blockchain comprises no key. To solve these problems, we have put together a HIPAA-compliant platform which provides blockchain as a service, BaaS. Our BaaS is a decentralized, autonomous, eternal, and private platform for backing up all your PHI. It is as easy as we share with you a HIPAA-compliant folder. You sync your PHI with the folder. All your PHI gets stored into the private blockchain. As a result, you can protect your vital patient data. Tamper-proof and easy to sync, backup, monitor, and trust. Thank you. DDS Blockchain and Blockchain Patients Data.